our clinical treatment record has opened, and we see that Miss Blair is here at the top. I have a quick view of her photograph, and I have her demographics up here at the top. We can easily see her phone numbers, any email addresses that may be in here, and those will be hyperlinked. I can get a quick view of any contracts that are currently running or due, and her outside doctors. So I can find any referred doctors or who she was referred by, and I can keep track of her last prophy date. So if I know that she had her cleaning before she plans on starting treatment, we can update that date from here and make sure we keep track of it to help her out with that. Next to that, we have our medical alerts so that we can easily enter in things that we need to know about the patient medically. We can hide those if they are sensitive, or we can add additional or edit the ones that are there. So if we have notes about medical history being updated, or if we want to go in and add latex allergies, that's an option as well. Our comments section also can be changed so that for sensitive information can be hidden and can be edited from here. We have found that most offices like to use this comment section for things that they want to know or they've discussed with the patient. If the patient has a European vacation coming up or anything else that you may want to chat with them about, we can save those notes here and edit those at any time. We can also pull up her family members. So we see that Miss Blair has a sister. Her name is, and she is currently in retention, and we can also open Elliot's chart right from here. So it makes it very easy, especially if you have younger siblings in observation. When we open their chart from there, it will let us toggle between two charts at one time in the same chair. So you are not limited to a single chart opening. So very easy to multitask with this clinical version of OrthoTrac. Now we also have her treatment bar, which we have not started treatment yet. If we are starting treatment today, I can go ahead and put my treatment dates in right here, or I can wait for them to post from my procedure codes. And I can also put in the estimated treatment date, finish date. So my estimated completion date, I'll go ahead and update that here. And we can also see in this section, it will track her no-shows, her cancellations, and her changed appointments so that we can have an informed discussion with her about keeping on time with treatment. It also pulls in information about breakage from our procedure codes. So in moving to this type of chairside electronic system, you'll want to go through any procedure codes that you may have or add them for any breakage for brackets, wires, or lost appliances so that those features can be tracked right here. So when I hit save for this, it will go ahead and update her treatment bar, and it will start to come across in green as I get moving through treatment time. And so when we have a nice visual aid as we get to the green towards the end, we can drop down our compliance and talk to a patient if they're not going to meet that treatment time. All right, now in our treatment history here on the left, we can usually see the last 2 to 3 appointments. It's very easy to scroll through and look through our treatment history, but we can also click the view all and get a nice big view with the colors that we may have used as we entered in our notes as well. So a lot of offices like this, especially moving from the paper card, because this view looks the most like what we are used to with a paper card. Now we can also see her last pan, as long as we are using our orthodontic imaging here, we integrated our ortho imaging system, it will automatically pull in the patient's last digital Panorex for us. And this is a setting that we'll set during training. And so at one click, we can pull up the patient's last pan. You can set that for a different image if you'd like, and the pan was the most requested item from our current clients. We can also see our treatment notes. So our notes tab here will let us enter in a quick write-up or maybe any other type of note, and we can pin the most important note to the top. So if you do have any type of sensitive information in your notes section, you can turn the eyeball off as well. So when we come into Ms. Blair's chart, those would not be visible. Along the bottom left, we have mechanics, documents, events, and aligners. So I'll go ahead and expand this box. We can see our current mechanics, so any arch wires that are currently in the mouth, and we can also see a history of the upper arch wire here, how many weeks each one was worn, the start and end date, and we can see that for upper arch wires, lower arch wires, and I have my boxes labeled for elastics and appliances. Now you can change the labels on these combo boxes and use them for anything that you'd like in maintenance. So this is just one of the suggestions that, that we have used in here. Our documents section is also very important. One of the things I like to note with our documents section is the ability to see our scan docs. A lot of offices ask me, how am I going to get moving? I'm currently on paper. How do I just start using this? And I am a very big fan of scanning in treatment history. So as soon as I can scan in, and you can see I don't actually have anyone's patient treatment history loaded. I've got derivatives instead, which is sometimes what our treatment histories look like, all of the great little T's and shorthand. So it's very easy to pull up a scan doc right from here. I can maybe see an exam form. It will also show you previous information and informed consents that have been signed. And I think I even have an extraction letter in here. So very easy to see those, and I'll show you how we can create those extraction letters in just a moment. All right, so there is my documents section. In our events, we have just a quick view of maybe our estimated completion dates again. This is a legacy box from version 12 that has pulled in, but some of the information that you'll find in here that you may need are your next appointment dates. So if you do have a next appointment booked and we want to review that, we can see that right here from our events box. Now, one of the upgrades that we got with version 14 was aligner tracking. This has been very, very popular with a lot of our offices so that we can track the number of aligners that a patient is wearing. We have expanded that number to all the way down to 80 with the latest version of the software. So I will go ahead and I'm going to go ahead and update her start date too. And let that reset itself. So it will go ahead and I can tell it how many trays we're wearing and how often we are going to change those trays. So she is set to change them every 10 days. And it will move her little yellow square for the tracking on where she should be. Now that I've readjusted, I'll have to close out and come back in. So I can easily see which tray she should be in and talk to the patient. If that's not the tray that she's wearing, we can click and verify a previous tray or to verify the exact tray that she's wearing so that it will restart the tracking from that point on. And I'll go ahead and do that for both her upper and her lower. Right, so that is our aligner tracking. You may have noticed the little diamond here. We are going to cover that on our tooth chart. That it lets us track and enter in IPR, so it's very easy to see how much interproximal reduction we've done on any one of our contacts and when in which tray we either plan to do it or finished the IPR. Today's treatment is here in the middle. This is where I'm going to enter in all of my treatment notes. So I do find that I tend to type a lot of the same notes over and over and over again. So instead of typing all of those notes in, we have a predefined comment box where we can easily enter in all of our quick notes. So if I have given out oral hygiene instruction, again, I can easily pop that note in and then continue to type any other notes that for today's treatment. All right. So these predefined notes you can enter in the maintenance menu. When you load up the software, our trainers will go through with you on how to get these entered, but I always say it's generally takes a little bit of a powwow with our clinical staff and the doctors to find out how we want those predefined comments in there and make sure that they represent the short form that your office understands. Our oral hygiene can also be graded right here. So we can click on our oral hygiene pictures, and looks like mine need to be set up. It does let you click and add in the Procter & Gamble oral hygiene pictures, and the letters can be added into the system. So it's very easy to grade the oral hygiene. All right. Last but not least, at the bottom of this section, we have our next appointment information. So I can easily tell the front desk exactly when I want to see the patient back and what I need to see them for. So when these appointments are scheduled, it does let them clear out so that it's a little bit easier to set these each time. We can see when we have or we haven't put in our the next procedure codes. We can type in any comments that are going to go on the scheduled appointment. And then also any future notes. So if I want to remember that in 3-4 months I want to take a pan, I can tell it that I'm going to take a pano or watch eruption, and I can set the date that I want to be reminded. These are also reportable. So from the main menu under the report section, under charting, I can get a list of all of my future messages that are due and make sure that those patients are scheduled for those next appointments. Now, the design on the main screen here on this treatment card is that our history is here on the left through what's currently in the mouth, and then through today's appointment, and then at the bottom for the next appointment. So it does kind of have a flow through the screen from left to right that makes it very easy as we're seeing the patient today to see what their history was, what we need to do today, and then what we're going to do next time. So our tooth chart, next tab here, I kind of like to think of this as an extra feature. So our tooth chart is going to let us do some great visual aids. So these can help both our referring doctors, our referrals, our outside referrals, and our patients. So we can easily click and add elastics in. We can right click and mark teeth as extraction. We see that added some additional notes here for which of those teeth we have selected. I can change my tooth numbers over between Palmer and Universal to make sure that my extraction requests go out correctly. And I also, under my elastics, I can either hit the plus sign and draw in some new elastics wear and tell it the type so that it's very easy to see which type of elastics box they need to pick up. And it will then close my elastic as I click OK and list any of them in here. It does list all of the previous elastics that configurations I've assigned for this patient as well. So this does become part of the permanent record. Now you can also predefine elastics so that it's easier to hit class 2 right, class 2 left, and click on those right from here rather than having to draw those in every single time. You also have predefined options with both the elastic wear box and the elastic instruction box. Now I had mentioned IPR when we were discussing the aligner tracking area. This is where we'll enter in the IPR in these diamonds that are visible here at the top and at the bottom. So if we are going to do some IPR right here on our lower ones, we will go ahead and click on that diamond and put in, it's assuming that we are doing it during tray 4 because that's the one we're on, but if we're going to plan it out for the next couple of trays, we can select those trays and the amount of IPR that we are planning and any additional notes. Hit the plus sign and it will mark that diamond with an open diamond for the plan. Once we've performed the IPR, we can click the checkbox and save it and hit apply. And now we have a record all of the time of the total amount of IPR we've completed on any one contact. So if we do IPR in several different stages, we get a total amount of millimeters. So we know what we've done on any contact. So that concludes our tooth chart tab. I'm going to flip over. Our questionnaire tab comes with the current system now. But I've found that when I speak to many offices about charting, they haven't fully implemented the questionnaires. So the questionnaires let us easily take any paper form that we're using inside the office and turn it into a digital form. So things like our exam forms, our progress reviews can be entered in. You can adjust pretty much everything in here. We can change the type of question from text box to multiple answers to tooth charts, or single answer questions. Here's a single answer question and I say her dental eruption is early. Here's an example of one of our tooth charts that will pop up for the congenitally missing or absent teeth. You can also use big multiple answer boxes like we see here for midlines. So when I say that her midlines are to the right or to the left, we've even set those with a quantifier, so it will ask for the number of millimeters. Now I can go through and make this from our system settings. We can make this be exactly like our exam form. And that way when we finish and we click OK, it will merge that in and we can set our merge fields in our diagnosis and treatment letter. So here we can go ahead and post and print letters to both our patient and our doctor with all of the responses from our questionnaire. All right, so that lets me post the letter, and of course that does take some setup on the questionnaires. If your office has never used the questionnaire system or too much of the letter system to create new templates before, we would recommend at least 2, maybe 3 hours of training with our training staff in order to get those set up. And that is in addition to the training that we'll recommend for the chairside charting module. Our notes section here allows us to quickly enter in our patient's write-up or any other date-stamped note that we might want that's not quite in our treatment card section. So it lets us free form. We can still use our predefined comments here. And we can bold, italic, underline, change the color of our text just the same as we've done with our patient, with our treatment entries. I mentioned our imaging section with our pano a minute ago. This is the integrated orthodontic imaging system. This system does integrate, of course, all the photos, x-rays, and if you're using our 3D equipment, we'll also integrate both 3D and intraoral scanned images as well. Now, last but not least, we have the treatment plan. The treatment plan is available, that's available here. A lot requires us to put in all of the different steps or appointments for the patient. We've found that many offices are unable to do all of the work that takes to put some of these treatment plans in here, but we do have some plans that are already created and support can help you load. And then all you need to do is put in the different appointment types and procedure codes. When we have an active treatment plan, it does tell us the next appointment and how long between each one. So we'll have target dates between each appointment. I have found that offices have more success in using this structured treatment plan for short steps. So a 4 to 5 appointment steps. So I prefer to call it an appointment plan rather than a treatment plan. So it lets you put together sets of appointments with those procedure codes and potentially a letter or a questionnaire so that those steps to either start or finish up treatment are done correctly. All right, that concludes our treatment card portion of